Imagine you're baking a cake,
Yeah.
right? You're mixing the batter, everything looks great, but then you accidentally leave a metal whisk in the bowl before you put the whole thing into the microwave.
Oh, no. That is yeah. That's a disaster waiting to happen.
Right, like, we instinctively know that is a terrible idea. You're gonna get sparks, you're gonna get, like, excessive heat, and you are basically gonna completely ruin the cake.
And probably the microwave, too.
Exactly. But what happens when the microwave is actually a high-tech medical device
Yeah.
and the cake batter is, your own body?
Yeah, that is a slightly terrifying thought, to be honest, especially given just the massive explosion of new medical technologies that are operating right at the intersection of aesthetic medicine and gynecology.
Welcome to today's deep dive. We have a highly specific and honestly slightly alarming mission for you today. We're looking at a massive stack of sources.
Yeah, we've got official FDA guidelines, the actual prescribing information for major IUD brands like Paragard and Mirena, and real-world clinical protocols from some top women's health clinics.
And we are combining all of this to answer one very urgent question.
Right.
If you have an IUD, whether it's a copper device or a hormonal one, and you're considering a vaginal laser or a radiofrequency treatment, could that heat accidentally, like, melt the plastic or heat up the metal inside you?
Because answering that requires us to navigate this really fascinating clash between the official, liability-focused warnings from device manufacturers and the practical, everyday reality of what's actually happening in clinical practice.
Okay, let's unpack this.
Yeah.
To really understand if these aesthetic or therapeutic treatments can damage your IUD, we first have to understand the mechanics of heat.
Right.
We need to know exactly what kind of energy is being introduced into your body and, honestly, just how hot it actually gets in there.
Yeah. So when we talk about these energy-based vaginal treatments, we're generally dealing with two main modalities, right? We have lasers and we have radiofrequency or RF devices. Let's look at lasers first.
Okay.
The most common ones you'll see are fractional CO2 lasers, like the Mona Lisa Touch is a big one, or erbium white AG lasers, like the Photona device.
And people are generally seeking these out for symptoms associated with GSM, right? Genitourinary syndrome of menopause.
Exactly.
They're looking to treat things like vaginal dryness, pain during sex, or tissue laxity that happens after childbirth or during big hormonal shifts.
Yeah. And what's fascinating here is how these lasers actually treat that tissue. I mean, they don't just magically make things tighter or more lubricated out of nowhere.
Right, it's not magic.
No, they work by triggering a biological response through, well, controlled thermal injury. So a fractional CO2 laser, for example, it creates these microscopic thermal microlesions in the vaginal mucosa.
Wait, so we are purposefully injuring the tissue to force it to heal itself?
Yes, exactly. So the laser emits a wavelength of light that's highly absorbed by water. And since the vaginal mucosa is, very rich in water, the laser rapidly heats that moisture, essentially vaporizing tiny columns of tissue.
Wow.
But because the energy is fractional, meaning it only hits these microscopic spots and it leaves all the surrounding tissue completely intact, the healing process is really rapid.
Okay, that makes sense.
The body senses these little microlesions and it immediately kicks off a wound healing cascade. So fibroblasts are activated, new collagen and elastin fibers are deposited, and angiogenesis occurs.
And angiogenesis, that's the formation of new blood vessels, right?
You got it. And that whole biological response is what ultimately thickens the vaginal walls and restores the moisture.
But to trigger that specific wound healing cascade, you have to hit a very specific temperature threshold, don't you?
You do. The therapeutic window for stimulating collagen without causing, irreversible damage is very specific. The target tissue needs to be heated to between 45 and 60 degrees Celsius.
Okay, so just for context for everyone, 60 degrees Celsius is about 140 degrees Fahrenheit.
Right.
So it is definitely hot enough to create mechanical damage to the surface, but it's carefully calibrated to avoid deep thermal burns.
Exactly. At that specific temperature, existing collagen fibers contract and untangle, which gives an immediate tightening effect, while that microscopic vaporization we talked about triggers the long-term remodeling.
Okay, so that is the laser mechanism using light to heat water. But what about radiofrequency devices? Because I see names like Thermerva or Vivev scattered throughout all our clinical sources.
Yeah, so radiofrequency, it bypasses light entirely. RF devices use an alternating electrical current to generate heat.
An electrical current.
Yeah. When this high-frequency current passes through the tissue, it encounters electrical resistance. The tissue basically acts as a resistor, and as the current pushes through, that resistance is what generates the heat.
Oh, I see. So it's relying on the tissue's natural resistance to electricity rather than targeting water molecules like the laser does.
Exactly. And because of that different mechanism, RF actually penetrates slightly deeper into the tissue matrix compared to lasers.
Okay.
It bypasses the surface epithelium and delivers heat directly to the submucosal layers to stimulate that exact same collagen remodeling. But, and this is important, it's still considered a superficial treatment.
Right. It's not going all the way to the organs.
Right. Modern RF devices used in these clinics, they're controlled by highly sensitive built-in thermostat systems. They are constantly monitoring the tissue temperature to maintain that optimal 45 to 60 degree range, and they'll automatically cut off the energy to prevent burning.
So using a laser is kind of like lightly steaming the surface of a delicate fabric to remove wrinkles, while RF is more like using a warm iron that penetrates a bit deeper.
Yes. That analogy perfectly captures the difference in depth and mechanism between the two modalities.
Well, okay, here is where I have to push back a little bit.
Sure.
If we are introducing 140-degree heat or, active electrical currents into the pelvic area, shouldn't we be extremely worried about a piece of plastic or metal sitting right in the middle of it?
It's a very valid concern.
Like, a Paragard IUD is quite literally a T-shaped plastic frame that is tightly coiled with highly conductive copper wire. And copper is famous for conducting heat.
Yeah, and if we look at the official rule books, that concern is the core tension of this entire discussion. The prescribing information for copper IUDs like Paragard and Mudela actually contains explicit safety guidelines regarding energy devices.
Yeah, I'm looking at the FDA prescribing document right now, and it states very explicitly to, quote, avoid using high medical RF transmitter devices in females with copper IUDs. And it specifically calls out a treatment called medical diathermy. What is that?
So medical diathermy is a therapeutic treatment that uses high-frequency electromagnetic currents to generate deep heat inside the body.
Deep heat, okay.
Yeah, it's often used in physical therapy to relieve muscle and joint conditions, or even in surgery to coagulate tissue and seal blood vessels. The manufacturers warn that these strong alternating electrical currents used in diathermy can interact with the metal in the IUD.
But why? Like, why does an electrical current interact so aggressively with copper specifically?
It comes down to electromagnetic induction. When you expose a highly conductive metal like the copper coiled around the IUD to a high-frequency alternating electromagnetic field, it induces something called eddy currents within the metal itself.
Eddy currents.
Yeah, they're basically localized circular electrical currents. And because the copper has its own internal resistance, these rapid eddy currents generate heat. In physics, this is known as resistive heating or Joule heating.
Wait, so the copper essentially acts as an antenna, like catching the RF waves, turning them into electricity, and then turning that electricity into heat.
Theoretically, yes, that's exactly it. The manufacturer's warning is based on the risk that the copper could absorb that RF energy, heat up significantly, and cause severe thermal damage or even necrosis to the surrounding uterine tissue.
Okay, so the manufacturer is literally saying, do not mix radio frequency and our copper IUD. That seems pretty cut and dry to me.
It does.
But then the exact same prescribing document presents this wild contradiction. It states that MRI machines are perfectly safe for patients with copper IUDs. And an MRI is a giant, incredibly powerful magnetic tube. How does a powerful magnet not heat up the metal?
If we connect this to the bigger picture of physics, the distinction between an MRI and diathermy becomes very clear. An MRI magnetic resonance imaging relies primarily on massive static magnetic fields to align protons in your body.
Okay.
Copper is a non-ferromagnetic material. It doesn't contain iron, nickel, or cobalt, so it literally does not respond to static magnetic fields. It won't be pulled by the magnet at all.
Okay, but what about the heat? Because MRIs also use radio frequency pulses to create the actual image, right?
They do, and that is where rigorous testing comes in. Researchers have actually tested copper IUDs under 3 Tesla MRI machines.
Which is strong.
A 3 Tesla magnet is incredibly powerful. It's twice the strength of a standard clinical MRI. And even after standing continuously for 15 minutes, which exposes the device to a massive static magnetic field and specific RF imaging pulses, the maximum temperature rise in the copper IUD was less than 0.5 degrees Celsius.
Less than half a degree. I
Yeah.
mean, that is a rounding error.
Yeah, it's clinically insignificant. The specific radio frequency pulses used in MRI imaging just do not create the sustained alternating electromagnetic fields required to induce heavy eddy currents in the copper.
Oh, I see.
So therefore, it's specifically the sustained deep tissue electrical currents of medical diathermy and high-level RF treatments that trigger the manufacturer's warning about thermal damage.
Okay, so the official manual says to avoid sustained RF energy if you have a copper IUD.
Hmm.
And this is where the plot really thickens when you look at the clinical reality, like what doctors and aesthetic clinics are actually doing in practice. The narrative completely flips.
That really does.
Major sources, ranging from the Women's Health Clinic guidelines in the UK to specific RF device manufacturers like Thermiva, and even prominent gynecologists like Dr. Ezra does, they all confidently state that you absolutely can have vaginal laser and RF treatments with an IUD in place.
And this clinical consensus is based on a fundamental reality that those broad manufacturer warnings just don't account for.
Yeah.
The highly specific anatomical map of the human body.
Right, because the body isn't just one empty hollow room where a laser beam bounces around and hits everything inside.
Exactly. We have to map the actual geography of these treatments. The clinician operating the fractional CO2 laser, or the RF wand, is exclusively targeting the vaginal mucosa, the walls of the vaginal canal.
Okay.
The penetration depth of these devices is incredibly shallow. I mean, a CO2 laser typically penetrates only a few hundred microns into the tissue. Even RF devices, which go slightly deeper into the submucosa, like we talked about, are designed to keep the thermal effect strictly localized to the vaginal walls.
And your IUD is located nowhere near the vaginal walls.
Right. The IUD is nestled high up inside the uterine cavity, specifically near the fundus, which is the very top of the uterus.
Okay.
And between the vaginal canal and the uterine cavity lies the cervix. The cervix acts as this thick, dense physical barrier of fibromuscular tissue.
So the heat simply can't travel that far.
Exactly. The energy from these aesthetic devices, whether it's the 60-degree heat of a laser or the controlled electric current of an RF wand, it just does not penetrate deeply enough to bypass the vaginal walls, travel through the entire density of the cervix, and reach the uterus where the IUD is securely housed.
Okay.
The physical distance and that tissue barrier dissipate the energy long before it could ever induce eddy currents in a copper coil or melt a plastic frame.
Okay, wait, what about the IUD strings? The strings hang down through the cervix and into the vaginal canal.
That is a very good point.
Right, because when a doctor places an IUD, they don't just leave it in the uterus. They leave a couple of inches of monofilament plastic strings hanging down. That's how you check that the device hasn't fallen out, and it's how a clinician eventually grips it to pull it out. Couldn't the laser or the RF wand accidentally hit those strings hanging right there in the treatment zone and melt them or conduct heat straight up the strings into the uterus?
So that risk to the strings is exactly why clinical guidelines mandate a strict protocol known as an anatomy-aware review.
Meaning the clinician has to physically map the area before ever turning the machine on.
Precisely. The clinician must perform a physical examination to identify the device type, confirm its position, and locate the exact placement of those strings before proceeding with any energy treatment whatsoever.
Okay, that makes sense.
And also, the strings are typically made of polyethylene, which is a type of plastic. They are not highly conductive metal antennas.
Right, right.
So as long as the practitioner visually identifies the strings and avoids direct, sustained contact with the laser beam or the RF electrode, the superficial energy operating in the surrounding tissue won't just magically jump over to the plastic strings and travel up into the uterus.
So anatomically speaking, the IUD is safe in the upper floor of the uterus behind a closed door, while the thermal remodeling work is happening down on the ground floor of the vagina.
I love that, yes.
And as long as the contractor knows exactly where the plastic pull cords are hanging down from the ceiling, you won't accidentally start a fire.
That's a great way to visualize it. The spatial separation makes the actual physics of heating the device highly improbable under skilled operation. But because those strings are present and the anatomical structures are so closely linked, the real danger in this scenario isn't accidental heating.
It's not.
No. The real danger is treating the wrong problem entirely.
Oh, because if you are experiencing pelvic pain or irregular bleeding, it could be the result of a dozen different underlying issues.
Exactly. And this leads us to the most crucial prerequisite emphasized across all our clinical sources. Clinical assessment is an absolute non-negotiable step before any energy device is used.
Let's talk about the overlap in symptoms then, because this is where the diagnostic waters get incredibly murky.
They really do.
Say you seek out a vaginal laser treatment because you are experiencing what feels like vaginal laxity or sharp pain during intercourse. You might just assume it's a symptom of aging or menopause. But an IUD itself can cause those exact same symptoms.
Yes. The guidelines from the Faculty of Sexual and Reproductive Healthcare, the FSRH, document extensively that IUDs can cause irregular bleeding, severe cramping, and in some cases they can facilitate pelvic inflammatory disease, or PID.
And PID is a severe complication.
Yeah.
I mean, the prescribing information for both Mirena and Paragard warns that PID can cause long-lasting abdominal pain, painful sex, and unusual discharge.
Yeah, it's very serious.
It requires immediate antibiotics, and if it's left untreated, it can lead to permanent infertility or even a systemic infection.
And beyond infection, an IUD can also become physically displaced.
Right.
It can partially expel into the cervical canal, which causes acute pain. In rare cases, we're talking up to maybe 2 in 1,000 insertions. It can even perforate the uterine wall, embedding itself in the myometrium, or even entering the abdominal cavity.
Oh, wow.
Yeah. Both displacement and perforation cause significant pelvic pain and discomfort during intercourse, which, as you said, can easily be misconstrued as generalized vaginal pain or dryness.
So you might walk into an aesthetic clinic thinking you just need a quick radiofrequency session to stimulate some collagen and fix your menopausal dryness. But in reality, your IUD has shifted into your cervix, or you have an active, hidden bacterial infection.
And throwing an energy-based device at an undiagnosed pelvic infection or a displaced IUD is a terrifying prospect, honestly, because the laser and RF treatments themselves carry their own profile of risks. This is a medical procedure. It's not a spa treatment.
Which is a huge point. The FDA actually issued a very stark public warning about exactly this. They notified 7 major device manufacturers, including heavy hitters like Alma Lasers, BTL Aesthetics, and Cynosure, about inappropriate marketing for quote-unquote vaginal rejuvenation.
Yes, I remember that.
The FDA had uncovered numerous adverse event reports detailing severe cases of vaginal burns, persistent scarring, and recurring or chronic pain following the use of these energy devices.
And it wasn't just the FDA. The UK's National Institute for Health and Care Excellence, or NICE, documented equally severe adverse events in their clinical overview of transvaginal laser therapy.
Really? What did they find?
They detailed cases of persistent and progressively worsening dyspareunia after laser therapy.
Dyspareunia being severe pain during sex.
Yes, exactly. In one specific case study documented by NICE, a patient suffered severe vaginal wall lacerations after resuming intercourse just a few weeks post-treatment.
Oh my God.
Yeah. The inappropriate thermal injury from the laser created rigid fibrotic scarring instead of healthy elastic collagen, which ultimately led to a foreshortened vaginal canal.
That is brutal. So you have a situation where you might have an underlying structural issue or an infection caused by your IUD, and you're seeking an aesthetic treatment that carries its own inherent risks of causing tissue lacerations, burns, and fibrotic scarring. You're literally layering trauma on top of trauma.
Exactly. And this is why the Women's Health Clinic guidelines stress a protocol they call a protective delay.
A protective delay.
Yeah. A laser or RF treatment should never, ever be used as a Band-Aid to bypass a definitive medical diagnosis.
Protective delay. So what does this all mean? It's like trying to fix a strange noise in your car by turning up the radio. You might have a serious engine issue, like a displaced IUD or an infection, and a laser treatment is just going to complicate the picture without fixing the root cause. You might even blow out the speakers on top of destroying the engine.
That's spot on. And this raises an important question about how patients advocate for themselves. A responsible clinician will not just accept a consultation fee and immediately turn on the machine.
Right, they shouldn't just be rushing you into the chair.
The protocol demands a thorough investigation. They must take a full contraceptive history. They must perform a bimanual exam to check for pelvic pain or cervical motion tenderness.
Okay.
They should ideally verify the IUD's placement with a transvaginal ultrasound and assess the patient for underlying pelvic floor dysfunction before a laser ever enters the room.
Because if you report any pain, unusual discharge, or unpredictable bleeding with an IUD, that absolutely must be investigated and resolved first. You know, I noticed our sources also highlighted that if you suffer from recurrent bacterial vaginosis or thrush, a copper IUD might actually be acting as a reservoir for that infection.
Yes, that's a really important point.
Bacteria and yeast can form biofilms that adhere directly to the surface of the device itself. So again, if you are feeling vaginal discomfort and a shift in your microbiome, throwing a high-heat laser at the vaginal walls when the IUD itself is harboring the bacteria is entirely the wrong clinical move.
The clinical guidelines are unambiguous on this point. Energy treatments cannot replace diagnostics, infection management, cervical screening, or targeted pelvic floor physical therapy.
Right.
Enforcing that protective delay to complete a full screening prevents compounding completely avoidable harm.
Okay, we have covered massive amounts of anatomical, physical, and technological ground today.
We really have.
Let's summarize the mission for you. To answer the core question, can you get a vaginal laser or RF treatment if you have an IUD? Yes, it is generally considered anatomically safe to undergo these treatments with an IUD in place, whether it's a copper Paragard or a hormonal device like Mirena.
Right.
And this safety relies on the fact that these energy treatments target the superficial walls of the vagina, which are physically separated by the dense barrier of the cervix from the IUD, which is safely housed up in your uterus. The heat simply does not travel that far.
However, the presence of explicit metal heating warnings on copper IUDs regarding medical diathermy, combined with the fact that both IUD complications and laser treatments can share overlapping symptoms like severe pelvic pain, bleeding, and painful intercourse, means your clinician has a heavy responsibility.
Absolutely.
They must perform a comprehensive anatomical check, locate the physical strings of your IUD, and definitively rule out pelvic inflammatory disease or a displaced device before they begin any energy-based therapy.
Sitting with all this information, it leaves you with a really provocative thought to mull over.
Yeah.
We're witnessing this fascinating, honestly slightly messy gap between the strict liability-focused warnings of the IUD manufacturers, who simply print, avoid RF energy entirely to protect themselves from worst-case scenarios, and the highly practical, anatomy-focused approach of modern aesthetic clinics who say, it's perfectly fine, we know the exact depth of the tissue and the geography of the uterus.
It really reflects the complex reality of modern medicine. I mean, medical technology, the engineering behind fractional CO2 lasers and smart thermostat RF RONs is accelerating so rapidly that official bureaucratic prescribing guidelines just struggle to keep pace with clinical innovation.
So who ultimately holds the responsibility for navigating these gray areas? Is it the massive device manufacturer who writes a blanket warning label to shield themselves from lawsuits? Is it the clinician who relies on their deep anatomical knowledge to override the manual and provide relief to their patient?
Or is it you, the informed patient, who has to understand the underlying physics and biology of your own body well enough to ask the right, difficult questions before you consent? It represents a profound shift in how we approach healthcare. We can no longer afford to be passive recipients of medical technology. We really must be active, educated co-pilots in our own treatment plans.
Especially when we are talking about mixing our delicate internal biology with high-tech machinery. Brings us right back to the kitchen in that baking analogy for the beginning.
Oh, yeah.
Your body might be the cake batter and the laser might be the microwave, but you are the head chef. You have to know exactly what ingredients, metals, and tools are in the bowl before you ever hit start. Thank you for joining us on this deep dive. Keep asking those highly specific questions and stay relentlessly curious.